Hello friends, about 10 to 30% of the people in India suffer from what is known as Gastroesophageal Reflux Disorder or GERD in short. Commonly we know this as acidity. GERD or gastric reflux occurs when stomach acid and food contents come back or regurgitate into esophagus. Esophagus is a pipe that connects our mouth to stomach. Now, each of us has experienced this regurgitation of food into our throat many times. But it is generally a chance event. It doesn't happen very frequently and it doesn't cause any other symptoms. This happens especially after we have a huge meal. But when this happens frequently, every week or more than twice or thrice in a week, then it needs attention, because if untreated or neglected, it can cause complications. Today we are going to see what is GERD and how to manage it. I am Dr. Prasad Honap, consulting physician, and you are watching Let's Talk About Wellness. GERD is a very common condition, but it is more common if the person is obese, in smokers or tobacco chewers, in alcoholics, or in those who drink lots of coffee or carbonated drinks. People with irregular eating habits, especially those who eat large late night meals, have more chance of getting GERD. Eating very spicy and fried food also increases the chances of getting GERD. What are the symptoms of GERD? The first and most important symptom is reflux of acid and gastric contents back into the esophagus. Number 1. Number 2, it can cause chest pain, and chest pain can be sometimes so severe that a person can seek medical advice at the middle of the night only to be told that there is nothing wrong with your heart. It is just acidity. Person can have a persistent cough. They can find it difficult to breathe. In fact, many people have been treated as bronchial asthma because they had chronic cough and difficulty in breathing. Another symptom is hoarseness of voice or change of voice. There can be difficulty in swallowing. These are some of the symptoms of GERD. As a common man, what you must understand is when to seek medical advice and not waste time in trying home remedies or over-the-counter medication. Especially if the symptoms of GERD become very frequent, more than twice a week, or in fact more than that every week, then you must go to a doctor and seek his advice. Number 2, if the pain is so severe and it doesn't respond to common over-the-counter antacid remedies, then you must seek medical advice. When you have difficulty in swallowing or when you have persistent nausea and vomiting, you must go to a doctor. Especially when you are above 50, because there can be something serious. People who notice dark black colored stools should seek medical advice at once. People who lose weight because of loss of appetite must also seek medical advice, because this may not be simple GERD. Your doctor will probably advise you many changes in your lifestyle and eating habits. You must keep your weight under control by regular physical activity. There should be no smoking and tobacco chewing. Alcohol should be avoided. Late night meals should also be avoided. Person should eat less spicy or fried food. Coffee and tea must be consumed in moderate amounts. Instead of eating two large meals, it is better to eat small frequent meals. Your food should contain a lot of vegetables and whole grains. You should ensure adequate water intake. I always advise my patients to have a glass of milk at bedtime if they like. GERD is a stress-induced disorder, and you must manage your stress, and if necessary, even by seeking medical advice. Friends, GERD is a very common condition. GERD can lead to complications. It does affect quality of your life. But the tips that I have given you may help you to manage your gastroesophageal reflux disorder. Thank you.